enorme placer de verdad estar aquí. Esta sesión tiene que ver con los desafíos que los hacedores de políticas encuentran.
On as small pilots and general early childhood development into national programs.
Que se convierten en políticas nacionales. Jamaica ha usado procesos
Which has evolved over a number of years, and I'm honored to be given the opportunity to share this with you. There were 3 stages to the process of how we got to where we got to. And the first was obtaining comprehensive information on the status of the early childhood sector. This happened in Jamaica in the late 1990s. The second was the establishment of a cross-sectoral state institution to develop and take responsibility for the early childhood sector. Jamaica's Early Childhood Commission Act established the Early Childhood Commission as a government entity responsible for early childhood development in 2003. The third stage was developing and implementing a comprehensive cross-sectoral national strategic plan for ECD. This first occurred in 2008 to 2013. We are now in the second strategic plan, 2013 to 2018. I will now provide you with a little bit of detail as to how this works in practice. First, the information gathering process. The information gathering process required not only information on the current status of all aspects of ECD, health, social sector, education, but it also required an understanding of the history of the process of early childhood development in Jamaica. In short, it was important for us to understand where we were and how we got there. For example, 95% of children are in preschool in Jamaica by the age of 3 years. This is not something that was instituted by the government or directed by the government. This was part of our history and our culture, where every child needs to be in school by 3. So it was a community demand and not government intervention. So if we're going to change things, we have to know about this because that's going to impact our change process. We also found in our information gathering process that less than a third of parents reported receiving parent support, and parents of children with disabilities were particularly challenged. Now, although we have so many kids attending preschool, we found problems of quality and inequity. So clearly for us, access was not a problem, but quality and inequity were. Parent support and the management of children with disabilities was also important. The research also showed that existing early childhood activities were poorly coordinated and would benefit from the establishment of a single coordinating body. This led to the second process. So the Early Childhood Commission, or the ECC for short, was established within a legal framework to take responsibility for the early childhood sector and to coordinate activities. The legal framework was particularly important. It ensured sustainability of the organization. It established the structure of the organization and ensured that it was cross-sectoral. And it also clearly defined the organization's responsibilities in law. The responsibilities of the ECC are to guide policy development, develop early childhood programs, monitor their implementation, regulate the schools to ensure quality, consult stakeholders, coordinate early childhood activities, seek additional financing, conduct research, and ensure public education and information on ECD. The third phase, which was then done by the ECC, was the development of the cross-sectoral strategic plan. The ECC used all available information internationally and locally, as well as public consultation to develop the strategic plan. Public consultation was hugely important because of the huge community input into ECD. The strategy used a life cycle approach with the first of 5 strategic objectives addressing parenting. The ECC then went on to lead the development of Jamaica's national parenting policy, national parenting strategy, through the development of parents' places, and national parenting standards. The second and third strategies focused on the needs of children 0 to 3 primarily, and were improving quality well child care at clinics, which included improving the ability to screen children and also improving stimulation, and also early identification and intervention for children with disabilities. The fourth and fifth objectives address primarily the children in the age group 3 to 6 years. So this was about regulating preschool, setting up an inspection and a regulatory system, and developing and supporting programs to improve the training of preschool staff and developing a child-centered curriculum. These 5 key objectives were then underpinned by 2 working processes. First, there had to be a cooperative framework with each agency or entity of government having its role to play and its own targets to be met. Second was a dependence on evidence, data, and information to guide decisions and for monitoring and evaluation processes. The cross-sectoral approach is implemented in various ways through the ECC. First, the ECC is governed by a board which is cross-sectoral in nature. So represented on our board are representatives from the Ministry of Health, Education, Labor and Social Security, Finance, the Child Protection Agency, the CDA, and the government's National Planning Agency, the Planning Institute of Jamaica, as well as independent actors, the private sector, persons in child psychology. So they're independent actors as well as government. A specific senior position in the organization for cross-sectoral work, the Director of Cross-Sectoral Coordination. The strategic plan is also cross-sectoral. For example, quality well childcare is a function of the MOH. Teacher training is a function of teacher training colleges. So the agencies sign memoranda of understanding with the ECC each year when we have our annual strategic planning meetings. The timing of the meeting is important because the agencies then put their plans in the budget for the next year. Will this work for every country? Probably not. Not especially the details, but the structure and the process may be useful. Has it been easy? Not by a long stretch. Cross-sectoral work is inherently challenging. People enjoy working in their own space. However, there have been tremendous successes. Thank you.